So today we will discuss about the primary health care. So primary health care, before starting the primary health care, first of all, health. Health is a complete state of physical, mental, social well-being, not merely the absence of disease or infirmity. Without any kind of disorder or disability or any kind of illness, if the person is without any kind of disturbances in their living functions and in their physiological functions, then we can say that the person is a healthy, and the health status of the particular person is good or very good. And according to the primary health care, so primary health care basically is a type of health care in which we have provided in the peripheral level, means at the grassroots level. Grassroots level means we have to provide the services according to their household services, and according to their community visits, and accordingly we have to complete their basic needs and basic services regarding their health conditions and health status. We have to provide all the necessary services, necessary equipments and necessary needs. We have to fulfill all the services at the grassroots level, means at the household level. So as a community health nurse, we always have to be aware and have to be prepared if we have to go to the visit in the community areas and in the family house. So in the next we have discussed about the definition. So definition accordingly, primary health care according to the Alma Ata Declaration. So Alma Ata Declaration, primary health care is an essential health care. Essential health care means to that type of care which we have provided the universally accessible and acceptable through all the participants and the community which can afford. All the people have to afford and accessible that kind of services and that kind of care services and that kind of treatment, and accordingly they have to survive according to that cares and according to easily accessible that type of care. And the primary health care services according to the every person without any kind of discrimination. We have to provide all the services without any kind of discrimination between their caste, religion, race, gender, any kind of socio-economic status or any kind of occupational status. We have to provide all the primary health care services. Next we will discuss about the essential elements. So elements are basically parts. Elements are basically the components which we have to follow, which we have to complete it in the primary health care. So there are basically 8 kind of essential elements. So first one is the education. So in the education we have to provide all the awareness regarding the health promotional activities. We have to provide all the health services, and we have to always educate our community peoples and families and individually. We have to provide all the educational material regarding the particular diseases or any epidemic or endemic diseases or any pandemic kind of diseases. For example, like in the COVID scenario, we have seen that various kind of health education programs and various kind of webinars or various kind of health awareness programs should be organized by the community health personnels. Next is the provision of safe water supply. So in the provision of safe water supply, we have to provide the safe water quality. We have to maintain the sanitation. We have to maintain the water sanitation, water cleanliness. We always should be aware about the waterborne diseases. Like waterborne diseases, as we all know, there are various kind of seasons in which the waterborne diseases are more prevalent, and various kind of microorganism in the water always exist. So we always have to be aware that if the water supply of a particular area should be clean or should be sanitized and should be maintained, because we have to maintain the health conditions of the particular person, or we have to provide the awareness and cleanliness and the sanitation to the particular community area and particular age group. Next is the prevention of locally endemic diseases. So In the prevention of locally endemic diseases, like there are various kind of endemic diseases, like if we talk about various, in the previous scenario there are various kind of diseases which are the endemic in nature. So we have to always provide the prevention of endemic diseases, and we have to provide, always we should be aware about the treatment and prevention and control of the particular diseases. Next is the maternal and child health care, MCH. So MCH is the basically maternal and child health care. We have to provide all the services in the mother, related to the mother and their child. Like in the family planning methods, in the maternal services we have to provide the education related to the nutrition, immunization chart, family planning methods and small family norm, and the immunization accordingly to the mother as well as their children. Or in the child health care services, we have to provide the services related to the breastfeeding, weaning diet and the immunization period, and accordingly we have to provide all the services to the child as well as the pregnant mother or lactating mother or any another mother. We have to provide all the services. Next is the appropriate treatment. So as a community health nurse, in a primary health care, we have always focused on the treatment and prevention of the particular health diseases or health conditions. So we have to provide all the appropriate treatment and appropriate awareness programs, and we have to always encourage the family members and the individual and the community peoples by through their role plays, through their skit programs or any kind of role play skit programs or any kind of educational material. We have to provide the appropriate treatment to the particular age group or particular area. So next is the provision of essential drugs. So provision of essential drugs like basic drugs, basic drugs like medical drugs like antibiotics, antiemetics, antipsychotics and any kind of antibacterial or antiparasites, any another drugs we have to provide. All basic drugs we have to provide in the primary health center, and we have to always provide the community peoples. Next is the promotion of nutrition. So as we all know, nutritional problem is more prevalent in the India country, in the developing countries. So we have to always provide, and we have to always encourage the family members, encourage the mothers, encourage their loved ones to take care of their mothers as well as their children and in the family member. Accordingly, we have to divide the nutritional program according to their age group. We have to provide the nutritional supplements to the child as well as the younger person or younger child. Next is the provision of essential drugs. So these are the basic essential elements which we have to always consider in the primary health care. So next is the principles. Principles of primary health care. So basically there are 4 or 5 principles of primary health care which we have followed, which we have kept in remembering in our mind. So first is the equitable distribution. Equal distribution, equitable distribution means to equally we have to provide all kind of services like the maternal services, child health services or drugs, provision of essential drugs like in immunization, maternal and child health care services, and occupational disorders or occupational services and school health services. We have to provide equally to every participants, every age group or every individual without any kind of discrimination. Then second is the focus on prevention. So we have always tried to focus on the prevention. We have always focused on the prevention, how we prevent certain kind of diseases, how we control we have to provide the control measures regarding the particular diseases. So we always aware and we always accessible to that services through which we have to focus on the prevention. We have to prevent the particular diseases. Next is the community participation. So in the primary healthcare, all community should be participate. All, if we have to promote the, if we organize a certain health educational programs or certain role plays, so always we have to insist those people should be participate in the particular role play or any kind of programmable activities. So accordingly, if we participate, if we encourage them to do also participate in that particular program, so community people should be aware and more encouraged and more educated about the particular event. So always in the primary healthcare we have to, or accessible, we have to adjust that the community people is also participating in the particular event. Then the intersectoral approach. So intersectoral approach means to multi-sector. So always not only the healthcare department or any kind of hospital should be involved in this kind of primary healthcare services. All the parties, all the sectors and all the healthcare organizations should be involved, like NGOs, like the community participants, community peoples, like the school in the community, particular community area, like in the any kind of religious organization in the particular community area, like the governmental bodies is also involved in the particular approach and particular. So we always provide the primary healthcare services with the intersectoral approaches. Next is the so immunity provision. So should we have to always encourage, we have to provide the immune, like we have to provide, encourage the particular areas people and particular individuals should be encouraged by the other peoples, and we have to always encourage the other peoples to do that the particular area to help in the survival of a particular diseases and to eradicate that particular diseases. So these are the essentials of the primary health care. So next is the role of the community health nurse in the primary health care. Basically there are many kind of roles in the primary health care. First one is the direct care provider. So as a community health nurse, she should always aware about how to provide the care to the particular area and particular peoples, and she always encourage the community peoples to do their self care, as well as they always encourage about the treatment services. Next is the role model as a counselor. She should always counsel the community peoples to always adopt the small family norms and family planning methods for the prevention of various kind of diseases and for the promotion of the small family norm activity. As a educator, she should always encourage the community participants. She should be encourage the community participants to how to prevent and control the community without any various kind of diseases. So these are the role of community health nurse in the primary healthcare activity. Thank you. I hope this is clear. If you have any doubt, then you can ask in the comment box. Thank you.